Oh, this is the thing, what was the same? They want people's names. For the big pictures. Yeah.
Good to go.
Yeah. It's public, it's up to them.
Thank you. I draw us back to the resumption of our Board of Pharmacy meeting today. I, Board Member Doyle, move to resume open session at 10:03 a.m. Board Member Chin,
Board Member Chin seconds.
Member Beeman,
Board Member Beeman, yes.
Board Member Evans,
Board Member Hemmons, yes.
Member Joyce. Member Joyce, yes. Board Member Patel,
Board Member Patel, yes.
Board Member Vipperman.
Board Member Vipperman, yes.
I will now ask Staff Member Schnabel to introduce our newest board member.
Thank you. This is Staff Member Schnabel. I'd like to introduce our newest member to the Oregon Board of Pharmacy and welcome her, Jennifer Hall. Jennifer is currently a clinical pharmacist at Legacy Emmanuel Medical Center, Randall Children's Hospital, and Unity Center for Behavioral Health in Portland. Jennifer obtained her Doctor of Pharmacy degree at the Pacific University School of Pharmacy in 2009 and has been a board-certified pharmacotherapy specialist since 2012. Jennifer's interest in the profession grew from working in food and nutrition in the hospital when she was in high school and watching her grandmother work as a nurse. As an undergraduate, she was able to work as a pharmacy technician and made many lifelong connections along the way that helped her decide that pharmacy was the right career path. Pharmacy was a huge field of healthcare that she wanted to explore. And now she loves to advocate to young people about pharmacy as a great career opportunity to consider. Jennifer has and currently serves in leadership roles on the Work Environment Committee, Union Contract Negotiations for UFCW Local 555, and is a shop steward in training as well. She also participates as an OG supporter for Ockley Green Middle School and Peninsula Elementary School PTA at her children's schools. She and her family have a mini zoo at their house with cats, a dog, chickens, a leopard gecko, and several fish. They love to go camping at their favorite spot in the Tillamook Forest every year and cook extravagant meals on the grill. They are strong supporters of girls basketball and are learning more about soccer. So these days, she would love to learn how to use her brand new sewing machine and take her mom to Iceland to see an art museum dedicated to her great uncle's artwork. And that is so cool. So welcome, Jennifer, and I will turn it back over to President Doyle.
Member Doyle, and that is a leopard gecko, not a leopard and a gecko. Jennifer Hall, speaking on the board and staff, I wish to extend you a sincere welcome and make note in the board meeting summary of your official attendance as a board member during a regularly scheduled meeting after your appointment by Governor Kotek. Would like to impress upon you and all board members the importance of being a part of an administrative body representing the people of the state of Oregon on behalf of the governor. You are here solely to represent the interest of the people of Oregon. It is important to remember that action is taken when the board is in session and no personal opinions concerning board matters should be expressed outside of board meetings, or that extreme caution be used when doing so if you are confronted with this situation. You should never be influenced you should never be influenced by pressure groups or groups having political or economic objectives as their goals. You should thoroughly understand the normal procedures for receiving complaints and that they should be channeled through the executive director for the entire board's consideration. All powers of the board are defined by statute and we cannot expand upon them. Jennifer, your appointment to the Board of Pharmacy is one of the highest honors that can come to you as an Oregonian. And it comes with responsibility, sacrifice, frustration, concern, and commitment. We'll need to continually study the statutes and rules and maintain a contemporary knowledge of the issues confronting the profession and business of pharmacy that may come before the board. Your attendance at every board meeting is important, and any planned absences should be communicated to the board president and executive director as soon as possible. conduct at a hearing, and the questions and remarks made during a hearing should be confined strictly to the charges considered in the complaint. Board meetings are conducted in accordance with modified Robert's Rules of Order. You and any board member may call for an executive session at any time, keeping in mind the limitations placed on such sessions by statute. The conduct of all board members affects the image of the board, the profession of pharmacy, and the governor. Diplomacy, tact, discretion, and decorum must govern each member's behavior while conducting the business of the board. At any time during this or any subsequent meeting, I encourage you to express any ideas you may have of the board's functions, ask any questions, even though the answer may be obvious to others. See that all decisions be made in a fair and impartial manner. Refrain from introducing any political or economic matters. Expect criticism from the public, licensees, and restaurants, and never engage in retaliation or act in any arbitrary manner because of criticism. Closing, Jennifer, I would like again to congratulate you on your appointment as a Board of Pharmacy member and remind you that your growth and effectiveness as a board member will depend upon your personal initiative and effort. Round of applause, please. There will be a change in agenda orders. We will now begin with waiver requests, topics originally slated for Friday's session with staff member Hennigan. For those of you on the phone, it's mailing number D as in Delta 2.
Morning, this is staff member Hennigan. On August 15th, we received a request, or I'm sorry, the board received a request for a waiver of the FPGEC certification requirement based on Oregon's revised statute 689.255.
Chrissy, I'm sorry, can you give me just a moment, please?
Sure.
I pulled up the wrong, give me just a second. I have to get it from a separate place. There's two versions. Yeah, but not the confidential one.
Let them know. I can start getting everybody.
There you go, Chrissy. Chrissy, you're all set.
Okay. We have the mailing up. This individual that's making the request is a pharmacist licensed by the Syndicate of Pharmacists in Egypt who obtained a Bachelor of Science degree in pharmacy from Modern Science and Arts University in Egypt. July 30th, 2019. This individual holds dual BSc degrees, pharmacy from Egypt and pharmaceutical sciences from the UK. And I apologize, it was also inadvertently missed that they also have a Master's of Science in Clinical Pharmacology from the University of Glasgow. The individual is requesting a waiver of the TOEFL and FPGEC qualifications for licensure. They are authorized for employment in the U.S. They provided course by course analysis from the World Education Services. They have not taken the TOEFL and are not licensed in any U.S. state or territory. NABP requires FPGE certification to ensure foreign applicants are thoroughly reviewed. NABP strongly recommends that board members follow their guidelines and require FPGEC certification. ORS 689.255 does allow the board to consider qualifications of any person who has received a professional degree from a school or college of pharmacy located outside the U.S., which has not been approved by the board. Board has recently adopted rules effective 3/1/2024, and those rules do not allow for a waiver of the FPGE certification unless they've attended one of the two pharmacy degree programs from either the Canadian Council for Accreditation of Pharmacy Programs, accredited in Canada or its jurisdiction with curriculum taught in English and who graduated in the period of 1993 through June 30th, 2004. Or the ACP accredited program at the Lebanese American University with a Doctor of Pharmacy degree and graduated after 2002. If the board were to issue a waiver of the FPG certification, this individual would likely not be able to obtain the required 1440 practice hours and take and pass the NAPLEX and Oregon MPJE and obtain licensure by 2/29/2024 to be licensed under the current rules, which would allow a waiver. I'll turn it over to you for discussion.
Member Doyle, thank you, Staff Member Hennigan. We will now enter board discussion with regard to the request to either approve or deny the waiver for the FPGEC certification. At this time, I'll start with comments from Board Member Joyce.
Board Member Joyce, we do look at these cases on an individual basis. And it appears to me that he clearly has the experience and education for us to approve his waiver. I'm looking forward to hearing other comments. So I personally, I would approve it.
Member Hennigan. Sorry, Board Member Griffin.
Dude.
He's the. I'm having trouble with my G's and R's and M's today, so.
Board Member Bimmerman, so clearly he's educated. However, we require that FPGEC certification. Is that the one that he did not, he has not taken, I'm sorry, it's not that one. It's the TOEFL.
Both items have not yet been taken.
Correct. I need that. I need that. So if he was to take that, I would be okay, but he hasn't taken that. He has no plan to take that. I am not in agreement with the waiver.
Remember.
Member Hemmons, do we know why he hasn't taken that exam?
I apologize, it is in the letter.
It's in her.
I believe they indicated that they need accommodation for testing like that, but that testing is very targeted and that person needs additional time, and felt that their background in education was enough for the board to consider to waive the FPGE certification.
Board Member Hemmons, I apologize that I may be asking questions that probably already answered. But just to clarify, he has access to take the exam, but needs accommodation to do so, but has not applied for the accommodation that he one day would need. And feels that their current level of education experience warrants them not having to take the exam.
Correct. The exam for the TOEFL, which is the test for English fluency, and then also obtain the FPGE certification, which requires the TOEFL.
Board Member Hemmons, do we know, I know this gets into some particular issues, but, and once again, I apologize that this information may be clear and I haven't seen it. Do we know what the reason for an accommodation would be? What accommodations would be needed? You know?
No, I did not go out and ask for additional information on that
But the
point.
candidate didn't verbalize exactly what type of accommodation they would need to be able to sit for that exam.
Do not believe so. I apologize. I did not go back and review the letter.
Thank you.
Member Patel.
Board Member Patel. For TOEFL, I know that's the English fluency exam. They just check whether you are speaking, writing, and reading. You're fluent in English. And I do know they do have the limited window. And if I have to give this TOEFL and Coosbay, good luck. I have to travel far and only certain location they offer the TOEFL. And then he had extensive study in English, and then I think he also was in the UK. And I do know that in European country, they are looking for IELTS. IELTS, I think that's what is there, is equivalent to TOEFL here. I'm pretty sure he done that. So giving all those, I think I would be comfortable to give Xavier for TOEFL, because he already done extensive schooling and study everything in English. FPGEC, I think that's the NBP standard. So I would definitely would say he might want to take FPGEC. I can go either way, but TOEFL, sure, Xavier, FPGEC, I can go either way, Xavier or to take it.
Board Member Doyle, I draw everybody's attention again that the motion will be to approve or deny the request for the FPGEC, and that we're not, I don't have directions that we're voting on the TOEFL exam at this time. So if there needs to be an amendment to that, I ask for staff input at some point during the conversation.
You wrote it.
This is Staff Member Hennigan. I believe that TOEFL is required to obtain FPGE certification.
That was gonna be my clarification with board member. That's why I was asking about that.
Board Member Patel, that makes sense because he want FPGEC because you can't take the TOEFL. That's okay.
Exactly.
Yeah. So in that case, I would say.
That was my point, board member.
Board Member Doyle. We have direction from the National Association of Boards of Pharmacy that direct its member constituents to follow their guidelines, of which that means a foreign graduate would take the FPGEC. I do not find substantive evidence for myself to vote in favor of overriding that requirement. Also trying to do some research on the universities and the degrees that were earned in Egypt from this institution. The Bachelor of Science degree is, I shall say, in my opinion, not equivalent to the PharmD degree. There is a lack of pharmacotherapy education, and the two subsequent degrees are in pharmaceutics or pharmaceutical sciences and pharmacology, and not the delivery of medicine, or sorry, the delivery of pharmacotherapy, i.e. The choice of appropriate medicine for patients. So I don't believe that even though it's a person with multiple degrees, it's not in the right areas to claim the equivalency and not mandating the FPGEC. Thank you.
Board Member Chin is grateful for your expertise and looking into the educational qualifications. At this time, I am not for allowing any requests to not be able to do these things. Yes, I think this person needs to do the recommended programs.
Member Hall.
Board Member Hall, I think I'll just have to abstain from commenting.
Oh, yeah, and Board Member Beaman, please. I apologize. I will have to very astutely remember that you're calling in today.
No problem. Thank you for accommodating me today. This is Board Member Beeman. I am not in favor of granting this waiver. I echo a lot of the same comments that Board Member or Board President Doyle had just stated. Thank you.
Staff Member Hennigan.
Staff Member Hannigan, thank you. I did have communication with the licensee and just wanted to give the board a little additional explanation. If the waiver were to be granted today, these individuals still needs to get licensed as an intern and then do 1,440 hours, take both exams and become licensed as a pharmacist by February 29th. And I tried to map out the hours they will have to work, assuming they would get licensed, I think it was the 23rd. They would have to work 12 hours every day between now and the beginning of February to obtain those hours and then take the exams and be licensed by 2/29. So just for your consideration.
Member Patel.
Patel. So why he has to that time frame? Because he has to take NAPLAX, right? Still, he has to take NAPLAX, even if I don't understand, I think, timeline.
Oh, this is Staff Member Hannigan, because on March 1st, the new rules go into effect, which don't allow for a waiver of the FPGEC. So they would then still also have to get a PGEC certification.
Oh, gotcha. So yes, that makes sense. He has to do all the hours and then take the NAPLAX.
Correct.
Board Member Doyle, are there any further comments with regard to this SPAR? Hearing and seeing none, I will make the motion. I, Board Member Doyle, move to deny the request to waive the FPGEC certification.
Vice President Shin, yes.
Member Beeman,
Board Member Beeman, yes.
Member Hall,
Member Hall abstain.
Member Hemming,
Board Member Hemmings, yes.
Member Joyce,
Board Member Joyce, no.
Member Patel,
Member Patel opposed.
Member Vipperman,
Board Member Vipperman, yes.
the motion passes with Board Member Hall abstaining, Board Member Joyce opposed, and Board Member Patel opposed. I turn it back to Staff Member Hennigan for number D3, internal renewal SPAR.
Staff Member Hannigan, thank you. We will give Rachel a moment to pull up the mailing for it. Thank you so much. This is another situation where we have a period of time before the new rules go into effect for interns on March 1st. So we received a request of a waiver of OAR 855-031-00103C, which would allow the renewal of an intern license, which is set to expire on 11/30/2023. A waiver of this is permitted under the current rules. This individual making the request has been out of pharmacy school for more than a year, which is why the current rules prohibit renewal. Once the rules go into effect in March, they will then be eligible for renewal because the new rules state that you can renew one time after graduation. So this request is to allow this individual to renew this time to maintain licensure through when they would be effective to renew under the new rules. So the request is to allow the renewal of the intern license through 11/30/2025. This would allow the individual to continue working in a pharmacy as an intern until the next allowable NAPLEX attempt and pharmacist licensure once other requirements are met. The individual is eligible for reinstatement of a pharmacy technician license if the board chose to deny the request. The intern license is not a requirement to take the NAPLEX or MPJE. However, it may be in the interest of public health and safety to have additional workers in the pharmacy who can practice versus assisting in the practice of pharmacy. This individual is working in a rural pharmacy.
Member Doyle, we will begin discussion with Board Member Vipperman.
Member Vipperman, I agree that we need him working in that rural area. It's the 3 months. He's had his license. It just expires, and we're going to give him what, 4 months, 5 months extension until he can actually reapply if he needs to, because you can only reapply one time. My question about this is, if we allow this waiver, is he reapplying on 11/30, or is that his one time, or does he get a whole nother time?
So because intern licenses are valid for a period of 2 years, but they would be eligible to renew their license that expires in 2023, and the renewed license would then be valid through 2025. And that's regardless whether they renew now or have to wait to renew under the new rules.
Okay, thank you for that clarification. Board Member Vipperman, I am okay with this. I'm okay with this.
Member Hennigan? Oh, sorry. I apologize. Board Member Hemmons?
Board Member Hemmings, I'm okay with it.
Mr. Patel, yes, I also agree. We should renew it.
Board Member Doyle, I believe the comments recommended by board staff in the assessment area, as stated, offer evidence for this licensee to continue in their current role, and I support adoption of this waiver.
Member Chin, support.
Member Holmes.
Member Hall, I support as well.
Or Joyce, support definitely.
This is Board Member Beeman. I'm in favor of approving the waiver.
We'll now move to motion. I, Board Member Doyle, move to approve the request to waive OAR 855-031-0030, para 3, para C, to allow individual to renew intern license through November 30th, 2025.
Vice President Shin, yes.
Member
Board
Beeman,
Member Beeman, yes. Board Member Beeman, yes.
Member Hall,
All yes.
Member Hemmons,
Member Hemmings, yes.
Member Joyce,
Member Joyce, yes.
Member Patel,
Yes.
Member Peppermint.
Board Member Vipperman, yes.
Motion passes. We will now discuss the proposed position statement related to buprenorphine access with staff member Schnabel.
The staff member Schnabel. Representatives from the Oregon Public Health Division Injury and Violence Prevention Program administering the opioid settlement funds for the state of Oregon, along with providers from OHSU, have met with staff member Davis and me on 2 occasions over the past couple of months. We've expressed concerns regarding the barriers to patients in getting legitimate prescriptions for buprenorphine filled in community pharmacies in the state. Each of their concerns stems from data presented in published research indicating that there may be significant barriers in access related to the stigma of opioid treatment by community pharmacies. Other potential barriers to access may be related to restrictions on purchasing buprenorphine by pharmacies concerned about disorder reporting requirements by the DEA. The OHA staff and providers felt that it would be helpful to make clear to pharmacists and pharmacies that buprenorphine is an effective and essential medication in recovery from opioid use disorder, and that pharmacies should work to maintain adequate supplies to meet the needs of patients. Draft statement on access to buprenorphine for patients requiring medication-assisted treatment for opioid use disorder makes clear that buprenorphine is safe and effective in treating opioid use disorder, and that pharmacies should make it available to patients presenting with valid prescriptions for it. I'd like to read the statement now, if I would, or if I could. I think I can. The Oregon Board of Pharmacy is committed to protecting the health, safety, and welfare of all Oregonians. Addressing the opioid epidemic is a critical public health priority, and ensuring access to evidence-based treatments such as medication-assisted treatment is essential to combating this crisis. Buprenorphine, a proven and effective medication, plays a significant role in supporting individuals with opioid use disorder on their path to recovery. Recognizing the importance of accessible and convenient care, the Board of Pharmacy encourages all wholesale distributors and pharmacies to maintain adequate supplies of buprenorphine to facilitate access for patients seeking treatment for opioid use disorder. Opioid use disorder is a complex and challenging health issue affecting countless individuals across the U.S. and the state of Oregon. Medication-assisted treatment has demonstrated efficacy in reducing the harms associated with opioid misuse, including overdose and infectious disease transmission, while promoting sustained recovery and improved quality of life. Buprenorphine, a partial opioid agonist, has been shown to be safe and effective in managing withdrawal symptoms and cravings, allowing individuals to regain stability and function within their communities. Community pharmacies play a vital role in healthcare delivery and are well positioned to partner in effective management of OUD by making buprenorphine available to patients seeking treatment. Pharmacies, particularly those in rural and underserved communities, are often the first point of contact for individuals seeking healthcare services, making them a critical and accessible resource for patients requiring MAT. Pharmacists are important members of the healthcare team, providing services that help support patients' physical, psychological, and social needs throughout their recovery. Board of Pharmacy supports minimizing barriers to accessing buprenorphine and other essential medications for those seeking treatment for OUD. Wholesale distributors and pharmacies are encouraged to make buprenorphine products available to the extent possible to support patients being treated for OUD. At the end of the statement. Staff would like the board to consider adopting this statement to encourage pharmacists to stock and dispense buprenorphine for patients requiring treatment for opioid use disorder.
Board Member Doyle, thank you, Staff Member Schnabel. I opened discussion with Board Member Hibbins.
I am okay with the statement.
Member Patel.
Board Member Patel, I'm okay as well.
Board Member Doyle, I believe that's imperative with regard to treatment of Oregonians for opioid use disorder, that this product be widely available in pharmacies. I was just reading an update from ASHP News this morning that there are opioid overdoses are leveling off, if you will, but still over 100,000 per year this last year. And so this as an additional tool really needs to be available from as many outlets as possible. Thank you.
Member Chin agrees with statement.
I agree as well.
Member Joyce, I have strong support for the statement.
Board Member Bipperman strongly supports that. Thank you for bringing this forth so that we can have it. This will be available on our website, correct?
Correct, and we will also send it out by gov delivery to pharmacists and pharmacies.
Yes, the more people that know this, the better. Thank you.
Member Beeman.
Board Member Beeman, I support the statement.
Hearing the general support with no concerns, I will motion I, Board Member Doyle, move to request board staff publish the buprenorphine access position statement on the board website, as well as notify all licensees and all appropriate drug outlets by email through Gov Delivery.
Member Chin second,
Member Beeman,
Board Member Beeman, yes.
Member Hall,
Member Hall, yes.
Member Himmons,
Remember him, yes.
Member Joyce,
Member Joyce, yes.
Member Patel,
Remember Patel, yes.
Member Vipperman.
Board Member Vipperman, yes.
Motion unanimously passes. We will now discuss petition requests with staff member Schnabel.
Thank you, Staff Member Schnabel. This is an SBAR, and the situation is that the Oregon State Pharmacy Association has submitted a petition to amend OAR 855-115-0150 which adds the term diagnose to prohibited practices as authorized under OAR 137-001-0070, petition to promulgate, amend, or repeal rule. Petition also raises the following concerns. First, lack of discussion on the rule by the board, specifically OAR 855-115-0150, and two, prohibiting pharmacists from diagnosing impacts access to immediate treatment, examples, COVID-19 antiviral protocol and PrEP protocols. Background, first of all, the concern about lack of discussion by the board, specifically OAR 855-115-0150. The board has discussed pharmacist authority to diagnose during discussions on a proposed shingles protocol at the October 2022 board meeting. That's mailing B4B at that board meeting. And it was recorded in the meeting minutes on pages 5 and 6. Based on the October 22 board meeting, staff added prohibition of to diagnose to OAR 855-115-0150, which was incorrectly numbered in the package at the meeting as 1200090. Same rule language was included in the April 2023 board meeting in mailing A7, and June 2023's board meeting in mailing C2, and in July's 2023 board meeting in the rulemaking notice of Division 115 related to pharmacists on page 26. Again, on August 2023 board meetings mailing C3, in the draft minutes, there was a motion separate from other rules in the package, and there were 7 board members in favor and 1 opposed to that addition to the rule. Prohibiting a pharmacist from diagnosing impacts access to immediate treatment. Examples being the COVID-19 antiviral protocol and the PrEP protocols. In the September 26, 2022 emergency use authorization by the FDA, the FDA required positive results of SARS-CoV-2 viral testing, which is within the scope of a pharmacist. And so the pharmacy board did adopt protocol based particularly on the EUA, which was consistent with the EUA. That was noted in the October 2022 board meeting agenda, and that was mailing A, page 4 to 27, and the minutes on page 3. It was also discussed in the November 2022 rulemaking notice, and that was in divisions 10, 19, and 20 related to pharmacist prescriptive authority and the COVID antiviral protocol for Paxlovid. Also discussed in the December 2022 board meeting in mailing B4A on pages 237 to 266. In February of 2023, the FDA updated the emergency use authorization requiring a current diagnosis of COVID-19. And in the February 2023 board meeting minutes on page 14, in the April board meeting minutes in mailing A2, and the May 2023 rulemaking notice, the board discussed and then repealed the COVID-19 monoclonal antibody and COVID-19 antiviral protocols because they were no longer consistent with Oregon law. And then in the June 2023 board meeting in mailing B1 on page 46. regard to the PrEP protocol, the board has adopted the pharmacist protocol for preventive care HIV pre-exposure prophylaxis. And it does authorize the pharmacist to perform an HIV test and requires that if the test is reactive, positive, or indeterminate, that the pharmacist indicate that fact, but also notes that that is not a diagnosis of HIV infection and requests that the patient needs further testing to confirm such a diagnosis and asks if the patient wants to see their primary healthcare provider, urgent care clinic, or county health department to further make that diagnosis. So diagnosis is not required for that protocol. There are related statutes, but I will skip down to the assessment. The board has discussed the fact that the practice of pharmacy does not include making a diagnosis on multiple occasions while drafting Division 115 for over 1 year. The lack of ability to diagnose does not deter pharmacists from participating in formulary and protocol prescribing under ORS 689.645, OAR 855.020, and the proposed OAR 855-115. Purpose in the proposed rule of OAR 855.115.0150 is to provide clarity to licensees about the lack of statutory authority for a pharmacist to diagnose. There's been a request to amend this rule pursuant to OAR 137.001.0070, and the Board of Pharmacy must invite public comment on this request, including whether options exist for achieving the rule's substantive goals in a way that reduces the negative economic impact on businesses, of which there is none. The board must, within 90 days of the request received on 9/25/2023, either deny the request in writing or initiate rulemaking. So the recommendation, and this is what staff will do, and there's really no need for the board to vote on this. The staff will, to comply with the provisions of OAR 137.001.0070, we will solicit public comment on the petition and provide those comments to the board. And then at the December board meeting, the board will review and discuss the public comments and then vote either to deny the request in writing or initiate rulemaking. Turn it back to President Doyle.
Thank you, Board Member Doyle speaking. Thank you, Staff Member Schnabel, for the review. We will, even though the plan of action is outlined for us, secondary to OAR 137.001.0070, I will open up the floor to receive any initial comments. And as Staff Member Schnabel had indicated, we will be re-reviewing this at the December meeting following comment from the public. I begin with Board Member Patel.
Board Member Patel, I know every time the rule was there about prohibited pharmacist practice, but I personally do not recall that we done robust discussion on that since I was on this board meeting, August 2022. I do specifically also remember in July 2023 rulemaking notice, I know that we supposed to discuss, but then we go on the break, and when we come back, we change the whole rule packet. So I do remember that. And trust me, I will remember that if we done the discussion on this. So I don't think so we did the discussion on that. And the why we should not put in the prohibited practice for diagnosis is because, as I mentioned earlier, that will create access to healthcare. Not only HIV or antiviral, but think about a strep test, your influenza test. So you test and then you treat them. Now, because of this, you have to send them to the urgent care. Now, if you have insurance, that's great. You can afford it, you go, no copay. But think about the people who don't have insurance, marginalized population, underserved population. For them to come to pharmacy and just pay for the cost of test and the drug versus you go to emergency or urgent care or clinic, pay for that office visit, and then come to pharmacy and pay for the drug. So because of that, I don't think so we should put in the prohibited practice. I'm not saying we should put on the rule that pharmacists can diagnose, but we can be just as silent about it.
Board Member Doyle. I appreciate some of the business components and potential relational effects that Board Member Patel brings up. It does, but our statute authority as pharmacists does not include to diagnose, and I appreciate the rules as written, that they help pharmacists clarify what they are, that they don't have the statutory authority to do. And I think that it helps them manage the pharmacy formulary protocols that we do have engaged in. It allows them to better and more accurately deliver them without crossing a line per se. I would say that I personally would enjoy the opportunity to serve Oregonians to a greater degree, allowing some limited diagnostic capability or making diagnoses that's within the scope of our practice. But that needs to be more fully elucidated through a legal or legislative process. And so I think in the long term, it'll be necessary to change the Oregon statutes to enable pharmacists to do this, and therefore thereafter the board would be, I think, more than happy to expand its rules. So, Board Member Chin.
Member Chen appreciates all comments previously made. I, as a public member, feel that statute doesn't allow, and I agree with having that as part of the rule so that there's clarity to licensees. And I think that the PFACABAC committee, the formulary committee, really works with suggestions on being able to have an expanded practice to have public access. And so we're working diligently with that committee to continue to expand what a pharmacist is able to do within statute. And so I think that's where we need to still have statute and rules match so that there is clarity. While being that, if at some future point statute changes, then we get to rewrite things.
Member Hall.
Member Hall, I do appreciate the idea of, increasing access for public. Need to a little more information, but it also seems pretty clear that when you're just taking like a test, it's really diagnosing, and that is unfortunate, but that's the way our system works right now. But maybe we could at it in a different way and try to, it wouldn't be under this particular rule that we're looking at, but creating access in that other committee that the formula, yeah.
Board Member Joyce, so I'm looking forward to the public comments and the feedback. Pharmacy is a first-line healthcare service, and obviously the ability for a pharmacist to diagnose on a limited basis will increase healthcare access to a lot of people in Oregon. I know that, obviously there's the statutes there in place. However, pharmacy as a field has expanded in clinical pharmacy services. I mean, and that's an expansion from what pharmacists used to do just a couple of decades ago. But then now clinical pharmacists are working collaboratively with physicians and nurse practitioners. Thank you. In collaborative setting. So I think we can look at, again, looking forward to public comments. We can look at where we can go with limited diagnosis abilities in the future, and just think about where the direction of pharmacy and how we can expand access to more people, because people go to the pharmacies first in a lot of instances. And so if they were able to go to the pharmacy, for example, to get their antiviral for shingles, if they have the current shingles, or we can look at into expanding what pharmacists can do if we look at their ability to possibly make some diagnosis.
Member Vipper?
Board Member Vipperman, so my thoughts on this are that it is in legislative that we cannot diagnose, not we, but the pharmacist cannot diagnose, and that's what we follow. The formulary committee works super hard to advance things so that pharmacists can do a lot of things other than, fill prescriptions and, be a clinical pharmacist in a hospital and whatnot. My thoughts are that I don't want to move so fast that we lose sight of what we're doing now as opposed to what we're going to do in 10 years. Because a lot has happened in the 7 years that I've been on the board. I mean, when I came to the board, we just were allowed prescription to write a prescription for birth control. And now here it is 7 years later, and we're discussing whether we're gonna allow diagnosis. And I know a lot of people move fast, and I know it's a fast world and things happen, but for me, the legislative authority is Trump's. I'm a rule follower, and if they wanted that changed, then that's the route they should go to change it. So I would not be a proponent for this.
Member Evans?
Board Member Hemmons, I think everyone here said in different ways that the statute does not allow pharmacists to diagnose. And I agree that it should go to public comment. And I also would say that public has a right if they feel that this is not something that is appropriate and that it has negative consequences to their health outcomes and their well-being, that they understand that they have the power as constituents within the state of Oregon to get this change on a legislative level.
Member Beeman?
Board Member Beeman, I look forward to public comment. I appreciate everybody's comments, and I echo a lot of the same sentiments. Thank you.
Member Patel?
Board Member Patel, just to clarify, our statute do not say that pharmacists cannot diagnose. I am aware the statute does not even say that pharmacists can diagnose. So with that said, I feel like it's up to our board members that we can make the rule because they did not comment on it.
Board Member Hemmons, Um, correct? Statute did not say that you can't, but the statute did not say that you can. And from what my understanding is that the statute doesn't tell you that you can, it means that you can't. Unless I am not correct about that. But yes, in theory, you are correct. It doesn't explicitly say that you can't, but it doesn't say that you can.
Thank you, board members, for your, the conversation and comments. I look forward to staff engaging the public with regard to receiving comment. And we will continue the conversation once we have that data at our December 2023 meeting. Board will now review and discuss the board action report with staff member Efremov. This is item number G.
Staff member Efremov, hello again. I'm just gonna wait one moment. Oh, she's quick on the draw today. All right, so just to help frame the conversation for the board, it's been a little while since we've actually had the time to rediscuss this topic. You might remember back in April of 2023, there was an SBAR that staff member Davis had presented to the board, specifically discussing disciplinary reports, and it discussed the situation that is occurring that OBOP utilizes a web-based search tool for the public to search for licensees and registrant information, including discipline. The system is passive and can be difficult for the public to navigate and access accurate intended information. The site does not provide active notification to the public of a licensee and registrant's discipline, and currently does not list a discipline for licensee and registrants that have not been licensed or registered with the board. Search capabilities are limited to the individual licensee or registrant. So at that time, staff was presenting this to share with the board that we are continuing to work to improve and increase public transparency related to these actions, and shared a lot of other information from different boards, including the medical board and the nursing board, and I believe the California, other state boards, Washington State Board, Virginia State Board, and sharing different ways the different states communicate this information more readily. And our assessment at the time was that it appears that many other healthcare agencies and other state boards report disciplinary information in a more robust and clear way to the public. And staff is going to continue to look for other options and how we can align to create more transparent communication via technology and other resources, but at the time we are a bit limited. And in that discussion from the board meeting minutes, the board discussed providing a monthly list of disciplinary actions issued of notices and proposed disciplinary actions to the public in an effort to improve that transparency. The board provided guidance for further work on this process and requested staff to bring it back, which we're doing today, and also gave the direction of staff to provide only final orders on this report. So to orient you to the report and kind of the discussion or the mock-up that staff had talked about, and being able to, if the board chooses to move in this direction, work into our workflow, would be to do a monthly report. And in this report, we would just add it to the website. I think we haven't really talked about all the details. We were waiting for your direction. But in it, just giving you a little bit of a sample, there's kind of the header in there that talks about where you can access, pardon me, full information related to orders. And then on the bottom half is the table of just orders that have been executed. So it gives the potentially the name, that would be board direction if you would like. At this time, we just did a mock-up of the initials, but it would give potentially the full name, the license number, and the case number. And then that would give notification of all of the action that has happened in the past month, and then the information that if the public would like, they could search further on the website to actually get the full report or the full order or information related to that action taken. So we're just looking for board direction. If you would like to proceed in this direction, staff can do so. And if you would like us to, you do want to proceed in that direction, would you like us to put the full names so that it aids in them being able, it really probably would need the full name for someone to really have that ability to then correlate who that individual is, to look up that case number or not. They could still see that information and then go to the website and try to find it. I don't think they can pull it up via case number, so they would need the full name either way to be able to go back to the website and look it up. So license number, you're right, they could look it up through the license number. Thank you. So I'm gonna pass it back to Board President Doyle. Sorry for that moment of thought and speaking simultaneously. To see what the board would like to do and provide direction to staff. Thank you.
Board Member Doyle. So this information is presented to us that the table that is shown on the screen is what could be posted to the website to enable transparency that adjudication has occurred. Even if the names are limited to just the initials, any person can do a license number lookup and find out the full name of the person or agency involved and can correlate then that to the case number. But this doesn't give any detail. There's no hyperlinks or anything that give details with regard to the cases. And they will then submit a public records request if they. So I'll stop there and allow staff member Efremov to clarify.
I apologize. So depending on the format, if it's on the website, staff member Efremov, I apologize. I also forgot to share that we are doing a bridge of the second, I guess it's the last line for individuals who do not have a license number. So maybe if I take a few steps back and share a little of the limitations within our software system. So if there is no software system is what directly links to the website and actually shows the information of the action taken. So if there is no license that was ever issued for that individual, there's not a bucket in our software information to be able to place that on the website. We're doing a patchwork to fix that. So for a certain period of time, if it is an individual that has not been licensed, a public records request would be required and we could provide that information. But once we get everything rolled out within the system to update it, everyone could go to the online verification site and search that site via the pharmacist license number, outlet license number, or potentially name and how you would like to proceed, and would be able to then see all the information on that individual. Does that make sense?
Board Member Doyle, all the quote unquote, all the information on the individual would be their very small amount of demographics, if you will, or but it doesn't accessing or reviewing this list identifies that there's been discipline, but it doesn't identify what the discipline was or what the case header, if you will, is.
Correct. So staff member Efremov, what would happen is they would go up and look up the individual, and it would also, so it'll show their disciplinary action report if they've had discipline. So it will then have not necessarily the report, but it'll have the ability for you to click on and look at the final order. So you could read the details of what had happened in that situation. And if they had potentially other cases, you would be able to see that information simultaneously there. So what we're currently just proposing is to do an up-to-date from today moving forward, a report monthly that shows in real time action the board has taken related to final orders when they're executed, and creating a list so that the public, if they choose to, could then go to the website and look at that order specifically and any other discipline that might be related to that individual.
Remember Doyle, so the information about discipline is readily available, but one would have to know that that person is disciplined in order to know where to easily look for it. This provides a chronology, if you will, of discipline, so it's an easy menu for then enable one to go search for the information that is otherwise already available.
Step and mouth. That is an excellent summary. Yes.
Thank you. This seems to be likely a very useful tool for persons who You will have a need to know about disciplinary actions against different licensees of the Board of Pharmacy. Board Member Chin.
Member Chin supports transparency, and for public, I would say I would really support putting the name, the full name, and not just the initials and license number, because if it is public, if they're not really able to know the license numbers of anybody particularly, unless they're looking at something on a wall, which is maybe accessible, but I don't think public knows to look for a license number. I know other boards publish full name, and it's not just by license number.
Hall. I agree. We should probably put the full name if public wants this to be useful to them. We need that.
Board Member Joyce, I definitely support the transparency, and the full name. A question, when are the orders officially executed? Once we've ruled on them and then the following day, or?
Staff member from that's a great question. So execution would be, as a reminder, on the staff delegated authority, you've given the executive director and the compliance director to execute orders on your behalf. The time will vary. So after a board meeting, notices go out typically within the first until the fourth week of the board meeting, depending on the volume. So within 4 weeks, everyone receives their notices, depending on if it's a licensee or an applicant. They have 21 to 60 days to respond to that. If they choose to sign the order, then that could expedite the process. As soon as staff receives a signed order, we execute that, and then that would be considered a final order, which could go into that next report. So if it happened, say in this example, anytime between 4/1 and 4/30, we received executed orders or executed orders that we received signatures on, it would be listed on this list.
And then I definitely support the full name, if I mentioned that or not. But yeah, no, I think this is great. Thanks.
Board Member Biberman. Why am I always the old odd man out? So I want to make sure I'm clear on this. This is not substituting for anything we do now, correct?
Staff member Efremov, no, this would be an additional report that is just manually done by staff to enhance transparency.
One time a month.
That is what is being potentially proposed, but if board members have other thoughts, there's obviously this is however you would like to do this.
And then Board Member Biberman, and so it's going to be on the website. People are going to be able to go to there and just click on it or on their name if the name is on there. And then it goes to, or so my hesitation is that we're doubling the work here, because anybody can go to your name and look up your file per se. And isn't that true? I mean, that's what people do right now. So this is just an extra step for you guys. Is that correct?
Staff member Efremov, yes, but my understanding it's something that can be done somewhat reasonably. I'm gonna maybe hand it over to our compliance secretary, Elizabeth Hughes, to provide a little further response.
Yeah, this is staff member Hughes. So I put together this mock report, and it would be my responsibility to put this together each month. I would say for my time commitment, this would probably take me 15 minutes at most to put together each month. And part of what makes this easier for the public and for our licensees to see what's going on is, as board member pointed out, they can go ahead and look people up, but they do need to know the exact spelling of their full name for our system or the full exact license number. Our system's kind of very particular about how the inputs go in. So this would then provide those details so they had access to be able to look them appropriately.
And are you expecting this to be relatively used often? I mean, is this something that we think that is going to be used often?
Member Efremov, I I don't know how the public will receive it. I do know that from other at least outlets or individuals who hire in different institutions, that this could aid them to be able to clearly look up. We do a lot of public request reports of has disciplinary action happened. Maybe that will lessen our public report burden. We don't really foresee the future, so we can't know for sure, but there are some indications that this would be readily used by many.
And just one more question. So each month it would just add on. And so you would be able to look for like a year's worth, or would it be something that was like, oh, okay, this is this month and this is, would it be added on?
Staff member Efremov, I think that also could be up to how the board would like it to be seen. We're happy to work with that. I think one limitation we do have with our website is up to 2 years of information is all that can be stored. So that would be our only limitation, and how we want to link that or where we put it on the website so that it's clear, you know, what month it is and that there is a Rolodex of that 2 years. We easily could do that.
All right, thank you for your.
Board Member Himmons.
Board Member Clemens, I agree with the full name. My question though is, will there be a hyperlink? I think I heard, Board President Doyle ask this question, but I don't know if I heard the response. Will there be a hyperlink? For example, I clicked on, is there a hyperlink, or is going to be a hyperlink which will take me then to whatever additionally was?
Staff member Efremov, thank you for bringing that up. There actually, it will not be, and unfortunately, the way our system communicates with the website, we can't have that. That's why we want to make sure that we have the full name written correctly and the full license number so you can utilize our system as easily as possible.
Okay. So the instructions, basically, this just tells me if someone has some kind of disability. It doesn't tell me anything else about what the disability is related to. If I wanted that information, I would have to go to the online, click on the hyperlink that's up top that says online license verification. And then I would have the information from this that I could then type in to then see what the disciplinary action was.
Member Efremov, that is 100% correct.
Okay. Member Henry, thank you.
Member Patel.
Board Member Patel, I just want to clarify, and I think we also asked last time too. So this one, in the new system is going to be once we decided disciplinary action, right? It's not like there is ongoing investigation and then you're, right? This one is done there. And then
Staff member Efremov, so we won't, this list is not including any notices of proposed discipline. It would only be executed final orders.
Correct. Is there going to be a closed cases? No, if it's closed, no discipline, then it won't be there.
This is only disciplinary action, so if it's not discipline, it wouldn't be listed here. Yeah, correct.
Member Beeman.
Board member Beeman, I'm okay with this. I like the direction it's headed, but I have no further comments right now.
Going back to Board Member Joyce.
Board Member Joyce, so is this similar to what the Virginia Board of Pharmacy had on their website? And has there been any pushback or negative feedback on the process, on this particular level of transparency, so to speak?
Member Efremov, I apologize. I am not as familiar with the Virginia website. I could do more research if you would like, but I definitely do not know feedback from them. We haven't reached out.
I think in one of the meetings, there was a demonstration from the Virginia website, and it was similar to this. And I was just wondering if there had been any pushback on having this much transparency. I don't know. And also, when we talk about executed cases, executed orders, that includes LOEs, right? Just no, it does not include LOEs.
Yeah, so Staff member Efremov, just and I apologize if I didn't make this clear too. It's disciplinary action report, so only things that result in discipline would be added on this list. So if anything was a closed case and a letter of expectation is actually no discipline, closed case, it would not be added on this report.
And you don't know of any negative feedback though, right?
I do not. I've not heard any negative feedback. I do believe that there were several different boards that were doing information like this. I can share my personal information. I was a pharmacist licensed in Maryland. In every newsletter, they would put everyone's name and all the discipline. It's not uncommon for it to be publicly out there in a more transparent way.
Excellent.
Member Chin?
Board Member Chin, in response to Board Member Joyce, I think this is the standard of practice now for organizations and boards. I don't think that, you know, a particular person might have maybe negative feelings about it if it was their name, but in general, in terms of professional use, transparency is the standard of practice.
Board Member Doyle, there is not a motion or anything listed here. We provide staff direction and feedback. I'm going to try and to encapsulate what I understood to be the board direction, and that is that we appreciate this effort and that we would direct staff to manage this process. And it seems as if the only change or to be determined is how long the data should be kept within this list. And it appears as if we have a rate limit of 2 years, and therefore it seems as if we would have a ongoing scrolling list that goes back as far as it can, which is 2 years, and then the older data drops off. It appears to be a reasonable approach for presenting this information on the website. Board Member Hemmons.
Board Member Hemmons, I just noticed something. So all of these are supposed to be, the order has already been executed for them to be here. So why does it say, for those with a license number, please use blah, blah, blah to search by person, facility name, da, 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 if an order has been executed? I thought the whole point of the list was that an order has been executed. Why is there an if here? If your name's on here, there was an order, so I would refine that and remove
Yes.
this if.
Staff Member Efremoff, yes, I apologize. I think this was originally written with the language of presenting it to the board with the either or, so we will definitely reflect the updated that it includes only final orders or orders that have been executed.
From the board members, are there any further questions or comments? Hearing and seeing none, we'll move on to the next agenda item. We will.
Just Board Member Hammond, so how does our comments get added in? Like, for example, that you wanted the full name.
Please, I didn't understand that to be the consensus. So I heard two people say that, so we can go do a round robin and see if that is requested. So the question on the table is, should the name be initials only or the full name? Board Member Chin?
Full name.
Member Hall?
Name.
Name, Board Member Joyce.
Initials. Board Member Hammond's full name.
Member Patel initials.
Board Member Doyle's initials. Board Member Beeman?
Board Member Beeman, initially I was a little uncomfortable with full names, but in order to search by something other than a license number, you may need to know to link it to a license number. And the full name is part of the final discipline report that is published. But I'm sort of on the fence between initials and full name, but I could see both both sides. In I guess I would say full name in terms of being the most transparent.
Board Member Chin.
Member Chin has a comment. This is, if we're not going to make this usable to the public, why do it if we're not going to make it usable? Why are we going through the motions to make something transparent that isn't transparent when you don't have the information available?
Member Hemmings agrees.
Board Member Doyle, according to my count, that was 5 members in favor of full name and 3 in favor of initials. Does anybody have identify a discrepancy with my calculation? So the direction to the board staff would be to include the full name. Pausing for any last minute questions regarding this topic. Hearing none, we'll move on to the next order of business. We will now receive an update from staff member Schnabel regarding strategic planning.
Staff member Schnabel. The contract for the 23-26 strategic planning facilitation has been awarded to Pivotal Resources, and I think many of you have already received contact with them. Our meeting in Newport at the Oregon Coast Aquarium is set for November 8th and 9th, 2023 to develop the board's 2024 to 2028 strategic plan. Meanwhile, board staff continue to execute the updated 2022 to 2026 strategic plan. And that is the end of my report. Are there any questions? Yes. Board Member Hemmings, sorry.
Board Member Hemmings, could I ask what process was undertaken to select this particular vendor? Was that done through the governors? How was determined that, was there public bid put out? How did this particular organization end up being given the contract?
Sure, I'd be happy to address that. There was a public bid put out. We worked with DAS through the required process through the state. There were 2 vendors. We selected this one.
The selection criteria is based on what? And who participated in that?
The as procurement officer, myself, Karen McLean, and Chrissy Hennigan evaluated the 2 proposals.
Okay, thank you.
Are there any further questions for staff member Schnabel about the strategic plan? Staff member McLean?
I know people are starting to ask me about details related to arrival and departure and hotels and whatnot. I'll send an email to the full board about that. Unless you have specific questions.
Thank you. We'll now move on to discuss financial budget information with staff member Efremov.
President Doyle, we actually are at the additional compliance secretary position discussion. There's no mailing for this though, but we do have something to show. Wait, what? It is with Efremov though. Thank you.
Thank you. Apologize for the confusion related to this. So at this time, we are requesting an additional administrative assistant position for the compliance department. And I think many of you might remember last year, we had requested additional staff, specifically a compliance officer, due to the extreme increase in workload in the compliance department over the past 10 years, but more specifically the past 3 to 5. And really, in order to meet the board and agencies' need to ensure patient safety, health, and welfare of the Oregonians. Thank you for that approval. That position takes effect in the 23-25 biennium, so we're currently getting that in process. as we are reassessing our capabilities and with the addition of another compliance officer, the increased workload that is occurring with our only two current administrative support personnel positions as administrative assistants, it has become overwhelmingly clear that that workload that is being currently placed on them is not capable of doing. We will have to make serious prioritizations, and not all the things that have been put on the plate are really able to get done as timely as we would like. So either increasing time of our abilities to do certain things, or having to reassess our priorities. And looking at all of those assessments, it seems like in the best interest of public safety and the ability for staff and the agency to meet the needs of the board, we are requesting that additional administrative assistant position in the compliance department. And what you can see here on this slide is just the current case numbers and the projection, at least at the rate that we have currently been going with cases in the 2023 year. So as you can see, from say, for example, 2017 from 572 cases to 2020, 706 cases to potentially 2023, 1,122 cases, many, a majority being complaints, many driven from consumers and the public. So as we are trying to ensure that the board can meet their statutory mandate to regulate for patient safety, staff believes that we need additional resources in the compliance department to meet this need, and is requesting at this time to get your approval to move forward in the process, which would then, I'm sure there's lots of other questions that I'll have to have our staff member head, staff member Clean to be able to assist answering some of those financial budget and how those requests align with legislative sessions and other things like that. We might not be able to get it passed right away. It might have to wait for the next biennium, but we are just asking for board support and ability to move towards those requests. And I will hand it back to Board President Doyle to have board discussion.
Remember Doyle. Can you please repeat what was approved for the 23-25 biennium and that you're in process for?
The compliance officer, sorry, staff member Efremov, we got an additional healthcare investigator advisor compliance officer position for the 23-25 biennium, and we are currently in the process of trying to get that position filled.
Thank you for clarifying. That was a compliance officer, and now you're requesting a compliance secretary position.
Staff member Efremov, I apologize. Yes, in the state system, it's typically considered an administrative assistant position is how the terminology we use today.
Thank you. I'll open up the discussion with board member Chin.
Remember Chin supports moving forward.
Member Hall.
Have too much of an opinion about it right now, but sounds like you guys need the extra help.
Board member Joyce, I strongly support it.
Thank you. Board member Bipperman, yes, I support that.
Board member Hemmons, I support it, but I have a question and a comment. So, just thinking upstream here, do we have any idea, or have we looked at why there's been such a significant increase in the number of cases? What's driving that? What do we think needs to be done about that? And that's going upstream, right? But I do support the additional staff, but I'm just thinking about, are we looking at what's driving this significant increase in cases? Is it more public? What's going on, right? I have no idea. Is that part of role of the board? Look at trends to see why, there are these increases in cases like this. I don't know. I'm just putting that out there, but I think we need to look at that. And yes, I do support the increase in staffing.
Board Member Doyle, Board Member Evans, that's just some rhetorical information to offer, or is that a question directed for staff at this time?
That's a question, actual question. Board Member Evans, right? So I would say, if that is within the board's purview to do, I would propose that that is something that we try to take a look at trends as to what's driving this. What, are there,
Thank you, Staff Member Efremov. I do think this is a great timing for that. Strategic planning is one of those times where the board gets together and talks about all of the factors that are potentially causing the increases in cases, and then what are factors that you can have an impact on and what are factors that you can't. So I think that would be a great discussion for strategic plan.
Board Member Patel?
Member Patel, yeah, I also have the exactly same question because it's like the volume is almost double in 5 years. But if you look, the more and more pharmacies are closing. So there's less pharmacy and more cases versus more pharmacy. And then you have these cases in 2017 or 2000 or whatever. So I would be very much interested in finding out like what happened since 2017 and 2022, because you can't say just COVID because that happened in 2019 and you see more impact in 2021, you know. I'll be very interested in looking that data. So you said, so there was one compliance officer position was open and now you're saying compliance officer secretaries, there's 2 positions.
Member Efremov, yes, I apologize if I provided a little confusion by sharing that. So by kind of supporting why we would need more administrative assistance is also an addition of another compliance officer, which is tackling the investigation, the inspection, and the other components. As I've talked about many times before, the state has multiple systems that we have to use to save data in 3 different locations for one thing that is a lot of administrative work that we would hope to relieve some of the compliance officers of some of that burden and give it to a administrative assistant to be able to do that. And then again, increasing the ability to do investigations, inspections, and more time intensive as the board directs for other things that relate to that skill level and that skill set, since we require it to be a pharmacist that has practiced for at least 5 years. So hoping that that would offload that burden. So at this time, the only request we are making is for an administrative assistant for the compliance department.
Thank you. And did we fill that compliance officer position or are we still looking? Just curious.
I will have an update to share at some point in the future.
So we didn't fill it. Okay, perfect. Thank you. And I'm support for that.
Member Doyle, I support searching or attempting to get approval for this position. Board Member Beeman?
Board Member Beeman, I'm in support.
Put it on here, do they? I don't know. You can just carry. Like to show you the motion to. It's just this direct step. We had motions.
I just remember going to direct board staff to move forward with requisite activity to hire or get approval for and hire a compliance secretary position.
Does
Board member.
Board Vice President Chin seconds, that's how it's written in the. I noticed what you're saying, so that's how it's written. I know it's an administrative assistant, but it's written here, and that's why we keep saying that word. Thank you. Second. All yes.
Member Beeman,
Board Member Beeman, yes.
Board Member Hemmons,
Member Hemmons, yes.
Member Joyce,
Member Joyce, yes.
Board Member Patel,
Member Patel, yes.
Board Member Vipperman, yes.
Board Member Doyle, The question then with regard to board direction, speaking of that position and trying to determine the history for the rise in cases related to the strategic plan. Going back to your strategic plan update, Director Schnabel, can you tell us if information getting back to Pete Pandy and his company, is there scope for having this conversation at strategic planning in November?
Yeah, Rochelle, with regard to trends involved in increasing cases coming to the board.
And establishing the reasons why that may be to help us better strategically plan for the future to be able to handle the number of complaints that are coming into the board.
I believe there is a session in which that could be inserted specifically. It's the, remind me of the acronym of the environment. The pestle activity could incorporate something more specific around compliance cases and make that request to them and use that to the
Yes, please do so. I believe that's the interest of the board to continue that conversation. Thank you.
This board member Bipperman,
Yes, please.
as long as you asked the question about the strategic planning. So so who's invited to the strategic planning? Is there other agencies invited to that, or is it just us?
Staff Member McLean, this is the board's strategic planning meeting. So it will be all of the board members and our leadership team, and the public is welcome to come. I think that's really the question that you wanted to have answered, right? Yes, the public is welcome to come, and we will have it available just like a normal board meeting. So people will be able to click on a link and access the meeting that way and listen to the meeting.
Oh, that's great. So it'll be virtual.
It can be virtual, yes.
Oh, that's fabulous. And then
People just like this meeting, they'll be able to listen to the meeting just like this.
and will they be able to make comments at the end, or I want to make sure that the public knows that this is an option.
We usually do have a time for public comment during strategic planning. We usually pick a time that it's going to happen, usually kind of at the end of day one or kind of at the beginning of day two. But we'll make that plan when it gets, as we continue to work on the development of the agenda. And yeah, so the trickiest part about strategic planning, as you know, from previous sessions, is the board will break up into groups at different times. So the people that are not there won't be able to kind of observe that because we don't have a camera, but they can always listen.
Sorry, Member Melvin. So last year, I just turned my laptop towards the room and they can totally see the room. Yes, so sorry, yes, just like this setup, same exact thing.
Michelle, people can also come in person and they can move about the room as they please.
And board members, one more question. Because we've had such different experiences in the last few years than we had when I first came on the board, which was robust conversations. Will the public be able to converse with us? Maybe. Will they be able to join in our conversation at all? Is that a no? Because I'm asking because at one point we did allow that, and I'm just asking. I'm asking because I want the public to know what is expected.
So this is Staff Member Schnabel. That has not been a feature of strategic planning since I've been the executive director. However, it's open for discussion for this particular strategic planning meeting.
Board Member Doyle, prior to my tenure on the board, I had attended strategic planning. 1 year, my estimation is that it was pre-COVID, so 2018 maybe, when it was held in a conference room, and I was not able to have, or did I choose to have direct dialogue with the members of the board, but I was able to move around the board and fully observe all the activity. And so it was rewarding for me in that aspect. And having collected, if you will, information during that whole meeting helped me develop some comments or recommendations that I had for the board in the public comment period that was held at the completion of the strategic planning session. Emmons.
Will there be security?
Will be held at the Oregon Coast Aquarium, and I don't know that they have, I assume there is some level of security for the Oregon Coast Aquarium, but there will not be specific security that I'm aware of at our meeting location.
Member Patel.
Board Member Patel, thank you, Board Member Whipper, when you bring that out. I didn't know that either, that you can convince, but I do support Board Member Doyle that it would be good if the licensee or public is also come and converse with the board member and they understand why, what's timeline or why, you know, we are making rules and everything. I think that will help them a lot to understand what they're doing.
Staff Member Melvin.
Thank you, Staff Member Melvin. The issue with some of this is the virtual component, which didn't exist in the past. So we have to think about making it accessible and fair to everyone, including people that attend virtually. So the way that we have public comments set up today is people sign up in advance. And it's easy to control, right? We can unmute people, they get their fair shot to talk one at a time. Now, in this environment for strategic planning, the people on the virtual call are going to see the room and they're going to just, there's no way for us to filter it. They're going to hear everything that's happening in the room. And that's multiple people working on the pestle exercise at once. It sort of is what it is. So are we saying, or is this bordering on not having sign up for public comment? I want to think this through just a little bit.
Staff Member McLean.
Staff Member McLean, I guess the only thing that I would like to share is that typically we do not get a lot of public that actually come to strategic planning, especially when it's not here in Portland. And that was assuming pre-COVID as well. There are probably places for maybe 10 people to come. This room is, you know, it's big enough for us. It's big enough for probably 10 to 12 people at the most to sit in this room in person. So people are welcome to come. I made arrangements so that they could have some parking availability. And we should make availability to, ideally, it's more coordinated if people sign up through the online resource that we have set up. But I would assume if somebody's in the room and we need to have a sign up sheet, we could add a sign up sheet in the room, like we, I think, do here as well. People can sign up on a sheet of paper to make public comment. So I don't think that's an obstacle for people. So they can sign up online. Rachel will receive that. And then we will have a piece of paper in the room if people want to do that too.
Member Chin.
Board Member Chin is just looking at our board council and thinking about public meeting rules and how, because I've never been involved in this strategic plan that had public members having direct access to an individual. So you're talking, I'm trying to sort out what you're talking about, what the public is going to do in the strategic plan besides make public comment. I mean, when Board Member President Doyle went previous year, he did not make comments during the meeting. He made comments during public session, or during the public comment session. And that, not doing it during that particular time and having any open comment at any time doesn't make sense to me in a strategic planning session.
Member Vipperman.
Member Vipperman. So I want to share my experience with the strategic planning of this board. When I went to the Oregon Gardens in 2017. So we all met there. There was other, there was the technician board was there. And when we got into our groups, they were able to come and listen in. And I'm just offering my experience and listen in and maybe give some feedback. It's what we want. It's what we want. That's the thing, is I want to make sure that everybody knows it's what the board wants to do. But it was eye-opening for me, because you're getting people that were here from, you know, all kinds of different areas, like the associations. I mean, and they were able to sit in and go, oh, okay, this is what I think, or this is what our thing, you know. And so, and then we came back together, and they weren't allowed to say anything. And then we spoke as a group. So that's what my experience is. And honestly, I got more out of that than my whole first year of being on the board. So I'm not advocating for that. I'm just saying this is an option if we wanted to do that. Although 10 people, and there wasn't a lot of people that came, but that seems to be about how many people came that 1 year. So
Yeah, some years we've had one person or two people, and it depends on where the meeting is more than anything else. And we really have tried to put our meetings in geographic locations where we don't get to very often. So maybe that we could draw some of the licensees from that area. So we haven't gone to the coast ever in all of my years with the board. So we were going to once, and we ended up canceling the meeting due to budget cuts in the state. But yeah, that is one way we did it that year with a different facilitator. So Pete might have ideas about that. I don't know. But it's really up to the board if you choose to want to have that available.
Brad Frohoff.
I just thought I would share a little bit maybe of context too. I was on staff during that time and attended that meeting also, but at that point in time, there was not I would say, as methodical and organized approach to meetings that we have today, so that every hearing that, you know, one person might have got to hear all these great things, but the rest of the board members didn't. So having that formalized approach of the public comment signing up so that all board members can hear the same things at the same time, so that all of that information can be shared equally and across the board. No pun intended, but pun intended. So I thought just a little bit of context from that framework for maybe why we become more formalized in the approach, still always encouraging communication, feedback, interaction, but having it in that formalized approach that it can be heard by all equally.
Board Member Doyle, we are in a situation where we wish to offer equity and access to attendance in the meeting. And I think that it's important to offer an online forum or virtual forum for that, because people may be disenfranchised to be able to travel to the coast for one reason or the other. And we, of course, also want to welcome the public in attendance based on the space limitations that I'm hearing that we're having. And again, to have equity in the ability for everybody to have an appropriate time and place to say their information, to be able for all board members to hear it. And the fact that the strategic planning meeting is a board of pharmacy meeting, it's apparent to me that we need to follow regular rule and protocol for such a meeting. And therefore, it's great that we'll be offering a virtual option. And it appears to me that it's necessary to follow the singular public comment session at the end of the meeting. I also want to emphasize that the strategic planning meeting is not a one and done event. We continue to work on those items thereafter. So even though the public comment period may be held at the end of the meeting, it doesn't mean that those comments are not later incorporated. So that comment public comment period is very important for us as well. And those comments will be included in further development of the strategic plan that is written up and later approved by the board several months later, if my memory corrects me. So at this time, we'll move on to the next topic, which is with Staff Member McLean about budget.
Staff Member McLean, so mailing H for orientation to the mailings online and for the board members. This mailing is actually 3 separate reports. It's the June financial report, which was the last month in the prior biennium. We started a new biennium July 1st. And you can see that we basically came in under budget, all things considered overall. We ended up with a pretty hefty cash balance ending month or ending biennium month. But if you go to the next page, page 3, sorry, the next page after that, that is month 13. And what month 13 is for the state is actually kind of a closeout month for the annual fiscal year. And we paid out remaining things that were for the old biennium in the month of July. And so all of those costs get booked back to the prior biennium. And so you can see that the numbers came down a little bit as far as the ending cash balance. We still were primarily under budget. We were over budget in personal services, which is not uncommon because, for example, any overtime that we have is not budgeted in the budget. It's not something they give us funds for, and we do have some overtime. There are also a handful of differentials that we have on a few salaries, and because of that, that's also not budgeted. Or if it is, it probably was under budgeted, and that is something that is really tricky to get into a line item in the budget, and this is at a very, very high level. Bottom line for the budget, we can't overspend what the limitation of the legislature has authorized us to spend. So where it says over and under, that's for this snapshot in time for this specific month. But overall, we were under budget. The last report that's in there is a little bit incomplete because we haven't actually implemented fully the current biennium. So this is the July expenditures from July of 2023, which is the first month in this biennium. And we will continue. We had over in revenue because we were in the middle of a renewal cycle for manufacturers and wholesalers and the drug distribution agents. And our normal expenditures were just beginning, which is why it looks so under. And you can see at the bottom of this page where it says end of biennium projected cash balance is $3,965,000. It's down now to 9.93 months from like 13 months is what it said in June. And the reason that is because we paid out a fairly large chunk of money for the prescription drug monitoring program. And so that money comes in during the pharmacist renewal cycle and it goes back out the door at the end of the biennium. And that just happens to tie very closely to the biennium. So we got our record keeping from the month of June. Chrissy did her magic in the database. We gathered it all together, worked with PDMP, made sure we had the right numbers of what we transfer over to them. So that's a pretty big chunk of change. It's almost $500,000. So shouldn't say that. Yes. Yeah, it's almost $500,000. So anyways, so we're on path. We're working on getting the financial plan implemented for this biennium with our accountant. We had a meeting with her this week. And just really looking at where the expenditures are going to be, what things we know are coming, knowing there's a transition of executive director coming and we're going to have an extra month of salary in here, those kinds of things. I'm really kind of looking at some of those finite things that I'm looking at to determine where will we be spending resources this biennium and do we know when it will happen. So is there anybody that has any questions immediately about that?
This is Board Member Chen. I just want to make a comment to maybe new board members and people who haven't had the talk about. As an agency, you have to have 6 months in your bank. Anything over 6 months, at some point, the governor can sweep that from you. So it's a real fine balance. All these agencies walk to keep that 6 months, not too much, not too little, not too overspend. It's an amazing balancing act, and I appreciate all that you do.
Staff Member McLean, thank you so much, Board Member Chen. It is a hard balancing and Staff Member Hennigan and I kind of agonize over our revenue forecast each biennium to try to do a we're like by next March, we will do a revenue forecast that gets us through June of 27. And that's a long time away. People make changes in their business choices. They move, they decide they're coming or going, or they're not going to do business in Oregon anymore. And it's really hard. And we're not unique in that it's hard to come up with these numbers. But everything when we develop the budget is based off of the revenue number. Do we have money in policy packages to pay for a new position? Do we have money in policy packages to pay for any new monies to add, which is what a policy package is? All of those things. I mean, I could talk all day long about money, but I'm happy to talk about it if you have questions. But yeah, it's a fine line, and you can see we have 9.3 months, and you can see right down there, I included what a 6-month number would look like.
Good question. Transfer out to Oregon Health Authority is almost about 600,000. So this agency give it to Oregon Health Authorities just because we have excess fund, or that's what we owe them?
Good question, Board Member Patel. Staff Member McLean here. There are two things that we are required by statute to transfer that money over to the Oregon Health Authority. One of them, and the bulk of that 600,000 is actually prescription drug monitoring program. And the other much smaller part, less than $60,000, I think, is actually for the workforce data collection survey that pharmacists and technicians do when they renew their license. That's like $4.50, I think, in the renewal fee. That money goes to a different section of Oregon Health Authority. So these are transfers out that we are required to do, and we do it based on counting information that is worked on through Staff Member Hennigan and the people that we work with in those departments to get the numbers right, and then we do a massive transfer over.
Isn't it kind of like a pass-through?
It's totally a pass-through.
It's a pass-through.
It's money in, money out.
Yeah.
The prescription drug monitoring program statutorily allows the agency to retain 10%. There's costs involved in our collecting and managing this money. So we retain 10% of that money, but the rest of it gets moved out. And it all gets moved out once a year to the prescription drug monitoring program. Anything that's extra that comes in after that, if people renew late after June 30th this year, we'll pay it next summer. So it'll be a much smaller number like next year that we pay, but the big number is at the end of the biennium because the pharmacists are renewing at that time.
With half the amount, it's just catch my eye.
I think, yeah, it's a big chunk of change. Yeah. I know now that I look at it on this page, yes, it is. It's a big change. I knew it was over 500,000.
Here for,
Questions? Thank you.
Thank you for your report, Staff Member McLean. At this time, we will break for lunch. It is 11:59. We will resume open session at 1 p.m.
Oh, we have to go to lunch.